My name is Hannah Scrivens, and I'm the Clinical Supervisor for the Soarin' Maternal Child Health Programs here at Intertribal Health Authority. One of the many things I've learned while working with the families and communities is the strength and resilience that people have. We work with families and I get to hear stories when I interview the women, and they tell me stories of their experiences growing up. Many in families that have survived through residential school and colonization, and these women have often had very, very challenging experiences, but a lot of them with support have really been able to work through the challenges that they've had in their childhoods, and hopefully I think most of them hope to be able to give their children something healthier than they perhaps had as they were growing up. And I think that's really exciting because that's where the healing happens, and I think if we can support families and support mothers and fathers to give their children the best experiences they can have, we can really make a difference in communities that is very significant. You know, I get to see women through their journeys. Some of them we see in really challenging times, but we also get to see them in the good times when they're looking at their goals. They might be going back to school, they might be looking at going back to work. So it's exciting, and I'm really lucky to do the job I do. I've also learned a few things about working with people who have FASD. First, one of the biggest things I would say is don't assume that professionals like doctors or social workers or nurses have a really good understanding. Many of them really need to have more education on FASD, and often if you've done the work of working with a family with FASD, you might have a better understanding than the professionals.
Hello, my name is Arlene White. I work with Intertribal Health Authority in the Soul Mentoring Program. I work with women and families from Nanaimo, Manaus, and Stamatis. Our program works with women in prevention of FASD or women who are affected by alcohol during their mother's conception and their pregnancy with that woman. So what we do is, with the program, we work with women for 3 years. In the 3 years, we hook them up with culture. We bring them to the resources. All thinking of one participant in hooking them up to culture, what we did is her and her family were at risk of losing their children. They're from the Coast Salish territory, so obviously they're hooked up to the big house. So I asked if they'd like to, reconnect and go to the big house, and we did that, and they danced. And after they danced, they felt grounded again, and they felt, they were grateful to be there. Also, reconnecting with their spirit, reconnecting with their culture. And after the evening was done, they were grateful. They thanked me. They got a chance to ground themselves and be able to focus on being well again. So I feel this is what our program is about, is connecting the women to themselves.
My name is Camille Henry, and I am from the Pakwachin First Nation. I have been working with Intertribal Health Authority for 3 years now as a SOAR mentor. Working as a mentor has been an amazing experience. I have learned a lot by working with mothers with FASD. Being able to walk with them while they go through their journeys and being able to see what their struggles are and how they learn to work through it. The one experience that really stands out for me was the time that one of the mothers I'm working with had an opportunity to get a FASD diagnosis. It was a great experience to know how the FASD assessment process works. My client had asked me to sit in with her while she met with the psychologist and then also during the clinic day, which is where she met the diagnosing team. I was able to be a part of this experience as a support person. It was a long day for my client, but she had felt so relieved afterward, hearing that she has FASD and also learning what her strengths and weaknesses are. She was so happy to be able to tell her family that she was diagnosed because they always made fun of her not understanding her behaviors. After being a part of the experience as a support person, I could see the benefit of a diagnosis of FASD assessment.
My name is Daniela Johnston, and I'm a family visitor with Minims First Nations. I've been working as a home visitor for the last 3 years. I have a strong passion for my work, and I enjoy spending time with the families and supporting them to their fullest potential. I like to bring programs to the community that help develop the skills in the art of parenting and relationships. I've had the honor to support families through pregnancy and the birth process. I've done as much as I can to deliver a program that's best able to support these families where they're at.
I'm Khayletz Danat, the female name to my father, Khayletza. We both share that name. And I was honored with that name when I was 15 years old. And my original name is Jacqueline Jacks from Sycom First Nation. I started working with Intertribal Health 2 years ago, working within my own community. I was quite young when I became a mother. I was 16 years old, and I was really honored and lucky to have my mother, Shiemtka. She's from the Stalo Nation, and she came this way to marry my father, Khayletza. And she started working within the communities over on this side here as a community health worker. And I watched my mom a lot, you know, when she was working with the communities, and I started working, I guess, volunteering or helping out community members when I was like 20 years old, when women started having babies themselves, and I would coach, and then I'd be there to support and help. And that's where I kind of first started out in those areas there, you know, with friends and family, and that's where my heart was. You know, I really enjoyed my work there, you know. And over the years I have continued on, you know, helping and supporting, you know, community members. And I think it's really important to have that, you know. I was really thankful and grateful that, you know, my late mother was there, you know, supporting me and guiding me along when I became a young mother. And I'm very thankful for that. Now, you know, it's my turn to offer that to other members. And I really enjoy my work. You know, my heart is really there with the people.
My name is Joyce Browning. I'm new to Intertribal Health Authority. I'm the maternal child health worker home visitor for the Penelakut community, which includes Tuffy Road and Penelakut Island. One of the important things that I've learned so far is that I'm here to help parents strengthen their own parenting skills. I'm not the expert here to tell them what to do and what not to do. A story that I find very interesting is When I was sitting with an elder, they had told me that my grandma was a midwife at the Nellicut community, and I find it an honor that I get to work with families and children also. Hi, I'm Lisa. Well, I'm through the Maternal Child Health for Homolko. I work with about 15 families. Maybe half of them are FAS. I think that we need, where the client is at, is meet their needs. So I could recall a story that we did with one of our clients was to do a picture book step by step. It was her first child that she had in the hospital and chose not to breastfeed. So what we did was did a picture book, because when we went to the home, we found it challenging and just asked her how she was making the bottles and that, and she just said it was just straight. So once we realized it was just straight formula, she wasn't mixing it with water or anything, because in the hospital they're already ready made. So it worked really well for them, and a couple of others too that we used the picture book. That we went step by step, so she was able to flip it until she got it herself, that she didn't no longer need to use the picture book that we had put together for her.
The main thing that I've learned with working with families is that they're often missed within the system. Somewhere along the line, perhaps maybe they need to be on disability, and if they've been in foster care, this hasn't been done, and they've already had 2 or 3 children. And if they were on disability, this would really help them financially, and also with community support. So it's like before 19 they have all the supports. Well, maybe, maybe not, but usually they could have some supports. But as soon as they turn 19, the support is not there. What I find with working with women is if we could assist or help or advocate for what's available in the community. On reserve, sometimes there's really not as much, and I think, a lot of people are aware. And we need to increase awareness with the leadership in the communities, on reserve with the chief and council and band members, healthcare workers and professionals. Include, we could have support for our families on reserve, to increase support, to increase resources, awareness of what's available for them as an individual, as a family, and also respect from community workers and community members. And just so that with the family, instead of they're being treated as, sometimes they're labeled as too lazy parents, that person doesn't listen, perhaps she doesn't know, they get labels. And if they had a better understanding of FASD, they would probably change their talk and say, well, how can I help you? Maybe I need to call you and let you know you have an appointment, or maybe, to change that talk so that it's more supportive to the parent. And this is the kind of information I would like to let the leadership know in the community, whether it's chief and council, chief counselors, healthcare workers, just so that, increase more respect for the individual affected by FASD. One of the things that FASD is a brain injury, and you can't see it sometimes, and I think that's why it's missed.
到这儿最真。